It is a privilege to moderate this event hosted by the Della Leaders Club, specifically the Global Health and Wellness Committee. And I would like to emphasize that I'm looking forward to hearing the wonderful and valuable insights from our guest speakers today. The topic that we would like to focus on is highlighted by many to be a pandemic within a pandemic, as we will focus on nutrition, mental health, and wellness in the digital era. Please allow me, before we begin, to share brief highlights from our distinguished speakers' bios, and I will only mention a few highlights, otherwise it will take up all our time today. First, Brian Kinzella, the founder and CEO of Rapport, a telehealth clinical practice founded at the height of the pandemic by mental health leaders at Columbia, Harvard, and other top institutions. Their goal was to make high-quality, accessible, and affordable care available to more people in the US and around the world. I would like to congratulate Brian with this occasion for receiving the Meritorious Public Service Medal from the Chief of Staff of the US Army for outstanding service to the nation's veterans, soldiers, and their families. Brian was profoundly affected by the 9/11 terrorist attacks and commissioned in the US Army in 2006. During the surge, he deployed as a captain and detachment commander to Baghdad, Iraq, in support of Operation Iraqi Freedom. Subsequently, he served in Operation Unified Response in Port-au-Prince, Haiti, providing much-needed humanitarian support from the devastation caused by the 2010 earthquake. Following active duty service, he joined BNP Paribas and was later recruited to Goldman Sachs as an investment analyst. Concurrently, in 2010, Brian founded Stop Soldier Suicide, a not-for-profit dedicated to veteran mental health and suicide prevention. He served as the volunteer chief executive officer and continues today as the chairman. In addition, Brian serves on several boards across healthcare, financial services, and technology organizations. Welcome, Brian. It's a pleasure to have you as a guest speaker today.
Great to be here. Thank you very much, Ingrid.
Thank you. And now Dr. Katz, who's of course our member at the Global Health and Wellness Committee for the Della Leaders Club. He's also a globally renowned specialist in preventive medicine and lifestyle medicine with particular expertise in nutrition. Dr. Katz is the founder and former director of Yale University's Yale Griffin Prevention Research Center, past president of the American College of Lifestyle Medicine, president and founder of the not-for-profit True Health Initiative, and founder and CEO of Diet ID. He's a fellow of the American College of Preventive Medicine, American College of Physicians, American College of Lifestyle Medicine, and Morse College at Yale University. He is also the recipient of numerous awards for teaching, writing, and contributions to public health. He was named 2009 James Beard Foundation Award nominee in health journalism, has been a widely supported nominee for the position of the U.S. Surgeon General, receiving 3 honorary doctorates. His most recent book, How to Eat, co-authored with Mark Bittman, is a 2021 IACP Awards finalist. Congratulations for that, Dr. Katz. So you also hold numerous patents and have more than 200 peer-reviewed publications, have published numerous articles, and 19 books. And I'm always very happy when I see your bio because it makes me feel good when people complain that I do too many things. I always give you as an example. So thank you again for joining us today, for both of you.
That's very kind. And I feel like compared to Brian, I haven't done nearly enough. So pleasure to be with you and a privilege to share the stage with both of you.
Thank you. And the reason why I wanted to bring you both is because I do believe both of you will share with our audience 2 very different perspectives, but that both are crucial for our global wellness and health.
Yeah, thank you so much. It's really great to be here. And again, thank you for Della Leaders Club for putting this together. The reason I'm passionate about it is because it's something that I've experienced firsthand in my life. I served on active duty from 2005 to 2010. And during that window of time, it was a very high operational tempo environment with a lot of deployments for our military. And as an Army officer and someone who spent time commanding soldiers in a combat zone, working in Haiti post-earthquake, you really saw firsthand how different people going through the exact same thing handled those experiences differently. And in many cases, at least from a mental health perspective, it was manifesting itself into attempted and completed suicides. And so that, for me, was a catalyzing moment to really dig in and figure out, what can we do better as leaders? How can we empower subordinate leaders? How can we think asymmetrically about this problem that our military is facing? And it was one of those experiences that, for me, catalyzed starting the organization Stop Soldier Suicide with two other Army ROTC brethren from Johns Hopkins University, which we had all joined after 9/11. And, when we started the organization back in 2010, it was very well intentioned, right? It was going to be a nonprofit to help service members get free mental health care. And what we realized over the last 13 years is how complex and nuanced it really is. And the fact that, suicide is the worst that could happen right at the end of a very traumatic experience, right? But there's a lot more that goes into it. And the further you can go upstream and the more data that you can collect and capture, the more effective you're going to be in terms of the service delivery of care. And so that was really something that we have worked hard to perfect at Stop Soldier Suicide, and really was also the catalyzing force behind me leaving a finance career to link up with the vice chairman of psychiatry at Columbia University, Dr. Fred Cass, and create Rapport, which was the notion that we could more effectively leverage technology and use technology to improve the service delivery of mental health care at scale for both psychiatry and medication management, as well as therapy. And that's what we're endeavoring to do at Rapport. And again, it's a lot to do with how we leverage data, how we work to understand outcomes and outcome measures and satisfaction measures. And then how can we make care more accessible by changing the cost structure through leveraging technology. And that's something that we've seen accelerating post the pandemic. And I'm happy to go into kind of some of the more details later on in our discussion about what we're seeing. But it's very clear that things like co-occurring needs across dual diagnosis cases, substance abuse, and mental health care, or even more specialized and nuanced things like for women's health or eating disorders and obesity or post-traumatic stress. Those require more custom and bespoke solutions. And it's really important that, care is individualized and people are, treated like people. And I think one of the things that, we have seen and we need to be cautious about is, this concept of a one-size-fits-all solution, right? Or really trying to just commoditize care. And while, at a systems level, we need to think about that, at an individual level, at a tactical level, we need to feel really good about, would our family members, benefit from going to this care. And so that's one of the reasons why I'm so passionate about it, is because at the end of the day, these are people who need help, and we have the opportunity to really get this right at scale, leveraging technology and best-in-class clinical care to do it right.
Thank you, Brian. And I hope our audience captured that you're focused on quality, because they have a lot of opportunities these days for this type of care. And I think what we're going to try to emphasize through our discussion today is that quality nutrition counseling, quality mental health counseling is very important, not just access. Thank you. And then Dr. Katz, you're also doing so many things, and you could have chosen many other domains. What led you to nutrition? And how does that tie into planetary health, which I skipped in the introduction because I wanted to allow you to maybe explain to our audience why planetary health and human condition are so tightly related as well.
Thank you very much, Ingrid. And Brian, I appreciate your comments very much. As you were speaking, Brian, I'm watching our session title scroll across the top of the stage. And it's interesting, nutrition, mental health, and wellness in the digital era. We're obviously in the digital era, but there are two ways to interpret that. One is taking advantage of that to develop and deploy new solutions. But the other, I think, is to acknowledge that being in the digital era potentially takes a toll on our mental health and our wellness. And I would translate wellness into what really matters: years in life, life in years. Ultimately, we hope for vitality and longevity. And vitality is both physical and mental. And one of the lessons I learned in 30 years of patient care is that there really is no approach to health and well-being other than a holistic approach. Everything is interdependent. Nutrition affects physical health, which in turn affects mental health. Nutrition directly affects mental health. Mental health affects every aspect of physical health. Nutrition and mental health affects sleep, which affects stress tolerance, which is an element of mental health. Everything is interconnected. We learn in medical school the ankle bone's connected to the shin bone. You may have heard that, but at a much grander level of choreography, everything is interconnected. So part of what is compelling for me about this session today is the intrinsically holistic focus. In terms of nutrition, its primacy in my career, I trained in both internal medicine, preventive medicine, public health, and I finished all of that in 1993. And that 30 years ago, a seminal paper was published in the Journal of the American Medical Association, Actual Causes of Death in the United States. It might just as well have been actual causes of death in the modern world. And for the sake of time, I'll cut to the chase. The authors, Bill Foege and Mike McGinnis, enumerated 10 modifiable factors that collectively accounted for almost all of the premature deaths and, by extension, chronic disease that burden our population back in 1990. What captured my imagination was that 80% of the impact was condensed into the first 3 entries on that list of 10, and they were bad use of feet, forks, and fingers. So lack of physical activity, bad dietary patterns, eating too much junk, not enough real food, and tobacco. So I was interested in all 3, but I was especially interested in nutrition because that's where the population was most confused. That's where it was easiest to get it wrong. So it was one of the top 3 predictors of all-cause mortality, total risk of chronic disease, and people seemed bogged down and confused about it. So every aspect of my career, from writing and journalism to patient care and research, has focused on that. And I have taken stock of the impact my community has had on this problem. Have we elevated the quality of diet? Have we eliminated the obesity pandemic? Have we alleviated the burden of chronic disease, notably type 2 diabetes, coronary heart disease? And across the board, I'm sad to say, the answers are no. These problems just keep getting worse. And of course, to whatever extent bad nutrition and impaired physical health contribute to bad mental health, that problem's getting worse as well. So if you're not making the difference you want to make, you have to try new methods. And so after roughly 35 years as an academic physician, I became an entrepreneur. And what we're focused on at Diet ID is democratizing access to the critical information about dietary intake and leveraging that to improve diet quality at the population scale, but in a highly personalized way. So we are the first fundamental advance in dietary assessment methods in about 50 years. We make it possible, and so here we're harnessing the power of the digital era. We make it possible to complete a comprehensive dietary assessment over any digital interface in 60 seconds, and what's reported back to you in real time is your diet type, operationally defined, your diet quality measured objectively, your intake of all the different food groups in servings, and your intake level of 150 different nutrients. And then we can compare that to the ideal diet for you, which we don't presume to know on your behalf, but we ask you questions. What is it you want diet to do for you? Do you want to lose weight? Do you want to reduce inflammation? Do you want to manage blood pressure, type 2 diabetes? And we then use algorithms to run all the diets in our diet map through those filters. And there's some plurality of diets available to you that meet all of those criteria based on the weight of published evidence. And then we ask you the critical second question. So Brian and I clearly align here. We want to have an impact at a population scale, but we totally agree about the need to personalize. It's not a one size fits all. There isn't one best way to eat that's right for everybody. So we ask you the second question: of these diets that satisfy your performance objectives, whatever they may be, which of them looks most appealing? Which of these is actually a way you'd like to eat? And once you make that choice, we compare where you are to where you want to be. And then we function rather like dietary GPS. We say, okay, we can plot a route from here to there and populate that route, not with a turn list, but with a sequence of tiny adjustments to your diet that, if you follow them step by step, will get you reliably to your destination. And then that does tie in with planetary health in two ways, Ingrid, and thank you for bringing that up, because one of the things I like to say at every opportunity, especially if I'm speaking to my colleagues in the health professions, is you really cannot be a health professional in 2022 if you don't advocate frequently and passionately for the health of the planet. Because we have some hope of being healthy, vital people on a healthy, vital planet, or we have no hope of being healthy, vital people. Those two things are ineluctably conjoined. Well, fortunately, the same shifts in dietary pattern away from highly processed foods toward real minimally processed foods, away from animal foods to more plant foods, that redound to the benefit of public health, human health, also redound to the benefit of planetary health. Less water utilization, less greenhouse gas emissions, preservation of ecosystems and biodiversity. But we can take it a step further. And one of the projects we're engaged in now at Diet ID is called Diem, as in Carpe Diem, seize the day, because we're running out of time. But what it stands for is dietary impacts on environmental measures. So in 2023, we'll be launching a derivative app on top of our primary health-directed app that will measure the environmental footprint of different dietary patterns and help you see where are you now and what are your options for reducing the overall environmental impact of your diet, and which of those looks appealing to you, which of those has the greatest reduction in environmental footprint associated with it. And we hope what we're doing now, which focuses on personal health and weight and all the usual stuff, is of special interest to slightly older people who are already concerned about their weight and health. Maybe not all that interesting to 20-somethings. But the 20-somethings realize they're going to need this planet for a while, so they're very focused on planetary health. So we hope to reach them, the millennials, and whatever generations come after them, I can never keep track, but those guys, we hope to reach them with Diem and empower people all around the world to modify their diet and make a contribution to planetary health one mouthful at a time.
Thank you. Actually, after millennials, you already have Gen Z, Gen X, and Gen Meta now. So there's three more.
I knew there were a bunch, but I've stopped trying to keep track.
Great. So I really appreciated the complexity and how nice you both described the passion that led you to this career. For the second round, I was hoping we can talk a little bit about the challenges that you see and what alarming trends. I think both of you described that you're trying to have an impact quite strongly on the outcomes. But how do we bridge this gap between the information we make available to the community and to those that are our customers or patients, and then transitioning to them actually doing what we offer them and monitoring if the impact is lasting? So let's talk a little bit about the challenges. Again, virtual care and virtual contact in the digital era allows us to provide access to more people, but then it's also a little bit difficult to bridge the gap to monitor what they're doing at home, right? And how to, if they need care in person, how do you work with other practitioners? So Brian, can you highlight a little bit how Rapport has managed the virtual environment and transition to brick and mortar, and how you collaborate with other specialties to bridge that gap?
Yes, definitely. Thank you, Ingrid. And David, I so appreciate what you said about not just holistic health, but also how it ties back into the environment and thinking more broadly about it. We could probably spend days talking about how to best tackle that, but really appreciate you sharing that, because I'm aligned with your thinking on it as well. And so, Ingrid, getting back to your question, when Rapport was conceptualized, right, it was taking best-in-class elements of technology-enabled healthcare service and business, right, from both the background of having built something as an entrepreneur and being really an investor and really thinking about business models, and marrying that with world-class clinical care, right? Columbia, Harvard, Hopkins, they're great academic medical centers for mental health, but their catchment areas, their footprints are still finite, right? I mean, they're not able to treat people all over the country, all over the world. And so how do you democratize access to high quality care? Well, luckily we live in a world now where technology, and this is pre-pandemic, right? Technology has allowed us to deliver that care more effectively and at a much better cost structure into individuals in their homes, for example, or populations that might not even be able to access, going somewhere because of associated costs, or elderly population, things like that. One of the things that the pandemic did was created massive tailwinds for not only the delivery and the more effective delivery of healthcare, but also reducing stigma for things like mental health care. And so it was a huge opportunity to seize the day, carpe diem, if you will, right, of an endemic need within our society. Unfortunately, there are still some elements of go-to-market that are restrictive, and some of those are regulatory constraints, right? There's a lot of talk right now about the public health emergency, which we're still in technically, right? Post-COVID, we're still in the public health emergency, and what the end of that will look like in terms of potentially regulation, reverting back to pre-pandemic requirements of potentially having to meet people in person to satisfy the regulation that was on the books, right? That is potentially now outdated. There are some elements of licensure requirements, right, which happen at the state level, right, that potentially create supply-demand imbalances for people who need help versus people that can provide help, not because the technology won't allow it, but because of the regulatory environment requiring these licenses at the state level. And there are some things that are in the works as it relates to that as well. And then I'd say lastly, the ability to take things like commercial insurance. We at Rapport accept commercial insurance, not just from the big four, the Aetnas, Cignas, Uniteds, Blues of the world, but even some of the other insurers as well. But there are a lot of requirements around taking insurance, going through the insurance billings and claims process. And so in order to democratize that high quality academic medical center care, right, we've recreated that at Rapport. Our clinicians are primarily staff clinicians. They have the opportunity for continuing education and virtual grand rounds and teaching and supervision, right? That same rigor that you would get at an academic medical center, but we provide all of these services for therapy and for medication management virtually. Now, there are some things because of the regulatory environment that are changing that may require sessions in person for things like the prescription of controlled substances. We'll see if the regulatory environment continues to evolve to allow some of those things to be done virtually. But it's not a panacea of things being perfect following the pandemic for technology-enabled healthcare services. There's still a lot that needs to be figured out to really ensure that patients and clinicians are empowered to provide the highest quality services in the most affordable way so that as many people as needed can get access. And that's what we're on the forefront of and really trying to innovate and be thought leaders on, which is how to actually execute that in real time. And so that's what we're up to at Rapport.
Thank you. Dr. Katz, how are you seeing the latest trends and what challenges do you see when you try to help people with their diet management and personalized diet? Actually, what you described is your approach is personalized medicine, right, for nutrition.
It is, yeah. Well, Brian's comments were great once again, and I completely agree. In many ways, the pandemic advanced the value proposition of telemedicine and virtual care. And allowances were made for the provision of care across state lines. And now one of the challenges is to see if that legislation can be made permanent so that it's easier to render care across geographic distances. One of the great advantages of using this digital era of ours to develop new models of care is it eliminates the barrier of geographic distance. But if we impose barriers of geographic distance, you have to be in the same place, more or less, to take advantage of a digital connection. In some ways, it defeats the very purpose of digital innovation, which says distance no longer matters. Electrons travel fast. So I share that hope. And of course, this is the space we're in as well. We embed and integrate Diet ID into electronic health records and telemedicine platforms. So we face many of the same challenges. I would say for us, Ingrid, that the biggest challenge is traditionalism. Medicine is a very hidebound industry. I suspect, Brian, to some extent that the military is the same, right? Big organizations that have rich traditions and that feel very strongly about the way they do things. So in medicine, if you get a new drug or a new technology for use in the OR, new instrument, for example, that's used very readily. Just like if you get a new advanced piece of equipment in the military, is probably used very readily. But new ways of thinking and new ways of doing things, those come very slowly in medicine. I don't know whether the military is better or not, but we're very hidebound. So much so that, as a historical example of that, when the blood pressure cuff was invented, the House of Medicine said, no, we weren't doing that yesterday. It can't possibly be important tomorrow. That's sort of the perpetual attitude. There's a certain arrogance there, and I'm not terribly proud of that, and it's something that needs to be overcome. Because adapt or die in any field, in any discipline, right? Constant adaptation is what survival and certainly optimization demands of us. So you have to be nimble, you have to be light on your feet, and that requires being willing to renounce things that become obsolete because of innovation. Medicine's not very good at that. So I would say that's probably our single greatest barrier. Everything is slow because nutrition is traditionally neglected in medicine. Doctors don't talk about it at all. They're not well trained in it. They don't feel they can address it very effectively. It tends to be subsumed within nutritional biochemistry, which leaves you with absolutely nothing you can say to a patient. And all of that's changing. So to talk about both the bad and the good, that's some of the bad. The traditionalism, the resistance to anything new, the it's not our job, we weren't doing it yesterday, it's not important, we want to wait for people to get sick and then treat them with pharmacotherapy. There's all of that. But there are movements that are pushing quite vigorously in the other direction. One I'm very involved in. I'm a past president of the American College of Lifestyle Medicine, and that's the fastest growing professional organization, certainly in medicine, but possibly across all disciplines in the United States. It's been growing exponentially. So there are now 10,000 members of the American College of Lifestyle Medicine. We recently had a meeting in Orlando, 2,000 people attended. And that growth reverberates around the world with sister organizations forming in many, many countries. And all of them are saying we need to get upstream of disease and look at the lifestyle factors that are the major predictors of disease. And of course, nutrition is in the vanguard there. So this growing community of enlightened clinicians worldwide is starting to exert a very strong influence on not just the practice of medicine, but related policies and legislation. And as an example of that, the American Heart Association, which of course is very influential in the House of Medicine, published a position statement in 2020 saying that diet quality is of such outsized importance in cardiovascular medicine that it should be captured and addressed in every patient encounter, if only we had a way of doing that efficiently. And of course, we do now. That's what this stage of my career is devoted to. We built that method. But that's very encouraging, and we anticipate that other venerable elements in the House of Medicine, ultimately the American College of Physicians, the American Medical Association, will take the same position. And at that point, you start to be where you get responsive policy reform and reimbursement, a willingness to say that clinical time and attention devoted to nutrition as the most potent predictor of hypertension, dyslipidemia, type 2 diabetes, obesity, coronary disease, dementia, cancer, disabling arthritis, sleep apnea, and all the rest, and impaired mental health, that we're going to have suitable reimbursement models for that. And we're going to allow for that to be embedded in telemedicine and virtual care and on it goes. So again, Brian and I share many of the same probably frustrations at the pace of change and aspirations about how we can align with essentially a gradual revolution that takes us from what we call a healthcare system, but really is a reactive disease care system, as it incrementally becomes, with a lot of us pushing very hard, an actual healthcare system that says we care about keeping healthy people well. We care about keeping people safe. We want to get upstream of bad outcomes. We don't want to just wait for Humpty Dumpty to fall off the wall and see how well we can patch up the shell. We can do better than being all the king's horses and all the king's men. We can take a look at the wall. Say, how about a seatbelt up there? How about we lower the wall? How about cushions at the base of the wall? Something better than waiting for him to fall off the wall and sending in an ambulance again and again and again, which is pretty much how medicine functions. So we're very much caught up in all of those trends. So tradition, history, definitely an impediment, but there are a lot of new winds blowing. And as best I can tell, they're all blowing in the right direction.
Thank you. I really appreciate both of your comments, and you already made one statement about policy and regulatory guidelines, so that's a segue to our third topic. I wanted us to talk a little bit about employee health, because like you already alluded to, people in the digital era spend not only a lot of time in the digital world for fun, but also for work and school. So we educate ourselves, we entertain ourselves, and now we have to also work in front of a digital venue of some sort. So the latest 3 months have brought on not only the World Health Organization to put out a new framework for mental health worldwide and wellness, both. Nutrition is a big part, and of course anxiety and depression, as well as suicide, were on top of the list as well. Our U.S. Surgeon General has put out an employee mental health framework, totally focused on that, the top priority. And then we have several other organizations that have published surveys that show alarming rates of not only nutrition problems like obesity increasing because of spending more time in this digital world, but also increased suicide and increased anxiety, depression, and insomnia, all these in employees. Of course, the frontline health workers are the most affected, and there the numbers are even above 50%. There probably PTSD plays a little role as well. So maybe I can hear a little bit from each one of you. How do you envision that we can reconfigure, recalibrate, rethink how we deliver care also to employees? And how can we collaborate with employers to design something that's more impactful? Because as you mentioned, once people go home, it's more difficult to change mindset and behavior. So Brian, any thoughts, any efforts in that regard that your team is doing?
Yeah, it's a great point, Ingrid, and something that societally we absolutely have to get right at a systems level. The economic rational actors, whether they're insurance companies or employers, right? They have to think about the total cost of care, the total economic burden that they're encountering when an employee, a member of their team, is not well. And to go back to some of the points David made, there's a lot that goes into that, right? And that's not just how someone who goes to a doctor and there's an insurance claim that's fired off for whatever they went in for, but it's all the things that lead up to that could be related to gut health or their diet or other habits they have, and how that impacts their mental health, and ultimately how it impacts their physical health. And going upstream is absolutely the way to do it. One of the things, though, that as someone who spent a lot of time in big institutions, that we have to get right is the ability to capture the data and then to effectively demonstrate quantitatively with qualitative overlays, right? The why, right? Why are we doing this? Why is mental health so important for us to get right up front? Because it's going to cost so much more if we don't get it right, for not just the individual, but potentially their family, and the total burden that we're going to all share from an economic standpoint. And so, one of the things we do at both Rapport and Stop Soldier Suicide is capture data and then help to use that data not just to inform, how to improve clinically, right, the outcomes for the patient populations and improve the clinical delivery of care, but also how do we shape that into the broader narrative about why our solution is so important to scale up, right, and for us to get that right, and ultimately that creates a competitive edge for us organizationally as we think about where capital is allocated at a systems level in terms of getting this right. So I think it really does come back to the utilization of data. Obviously, it has to be secure and confidential, right? Especially as it relates to healthcare and mental health care. But how do we use that data to really tell the story that's so important for those arbiters of dollars to actually more effectively run their organizations?
And for us, Ingrid, this is a primary focus for us. We're a B2B company. Diet ID is a SaaS company, software as a service. And our two principal deployments would be to health systems and entities within the overall healthcare system. And self-insured employers, and most large employers are self-insured. So they're really a crucible and an incubator of value-based care. Value-based care is a concept that's now reverberating through all of medicine in the United States. The idea that we shouldn't just pay for a service, we should pay for the value of the service. And keeping healthy people well is the ultimate value of effective clinical intervention. And then if people get sick, reversing that and making them well as they possibly can be should be the goal. So let's identify the outcomes we want, and let's provide a certain sum of money to achieve those outcomes. And if you can do that more economically and more efficiently, the profit margin is greater. That's value-based care. So most self-insured employers are in that situation. They have a vested interest from a healthcare expenditure perspective of keeping their population well. And then, as Brian suggests, they have many other motivations too, because a healthy workforce is more productive, is more effective, right? So you've got absenteeism that you want to reduce to the irreducible minimum. You've got presenteeism where people are there, but essentially the lights aren't on. They're just not thinking well, they're not functioning well, they're not being productive. We actually took the nutritional contribution to all of that and calculated its financial implications. We published a paper in the American Journal of Health Promotion called The Financial Case for Food as Medicine, Introduction of an ROI, Return on Investment Calculator. That calculator is freely available to all. It's in the public domain. If you go to dietid.com and click on the Science tab at the top, you'll just scroll down, you'll see the calculator. And you can, if you're managing the health of a population, you can enter in either default values for the prevalence of all the various conditions among adults here in the United States, or you can substitute values for a given population and see if we were to improve diet quality. What would that translate to in terms of dollars saved? And those numbers are incredibly impressive. There's a tremendous opportunity to leverage what we know about lifestyle as medicine. And again, nutrition is one element of a holistic package there, but I would argue it's in the vanguard. To add years to lives, to add life to years, to help save the planet. And, oh, by the way, if you're currently holding the bag for the cost of all the bad stuff that is imposing a burden on modern epidemiology, save a ton of money. So, talk about a win-win. I think that's a win-win-win-win at a minimum. And that's really where this all needs to go. So, we want to shift the financial incentives to those who care about achieving wellness. The incentives in the disease care system I referred to a little bit ago are somewhat pernicious because, of course, hospitals make money by filling hospital beds. They actually are ambivalent about keeping healthy people well because if they've got beds that are unoccupied, they're spending money without making money. That's really not good for them. So what we have to do is think about this disease care system morphing into a healthcare system by diversifying its portfolio. Much the same model really that pertains to the energy sector. Right? The big oil companies command massive resources. They're not just going to go away. So what we want is to encourage them, give them good reason to invest in sustainable energy sources, wind and solar and wave. So I don't care if those same folks become, the guardians of the energy sector in the future, but I do care what happens to the planet. So I want them to be offering better wares. Much the same is true in medicine. If we can keep healthy people well, that's much better than waiting for people to get dire chronic disease and reacting to it. And if we need the healthcare system players of prominence to benefit from that, they need to start investing in overall wellness. And we're seeing some signs of that. And I would argue that self-insured employers are in the vanguard of it because all the incentives are right there.
Thank you. You can each share your prediction for next year. What will change, if anything, and how will your team contribute to that prediction?
It is my hope that we can pass federal regulation, legislation really, into law to sustain many of the innovations in healthcare services and technology-enabled healthcare services that came out of the pandemic, and actually make it law such that those innovative companies and clinicians can really then take that framework and those left and right limits and just continue to build really great businesses, really great organizations to deliver the highest quality care to more people who need it. And so is my hope and my prediction that something bipartisan will become law.
Thank you. David?
Now, Ingrid, one of my favorite quotes, whoever said it, you never know for sure, but the best way to predict the future is to create it. So one of my predictions is that Brian and I are going to find a way to work together, because I'd very much like to do that based on everything I've been hearing today. And then in my home turf, the prominence, the salience of food as medicine will rise considerably. It's ascending briskly already, but you'll be hearing more and more about that and more about models to support it, whether it's innovation in the private sector, meal kit companies, medicalized food, all of that, and digital interventions, digital therapeutics, or it's policy reform to support it. But it has tremendous momentum, and that's because it's responsive to so many needs. Again, it targets the single leading predictor variable for total mortality in the United States, full stop. It targets the leading predictor of chronic disease. It targets a major drain on the economy. And because we have so much evidence about the good we could achieve if we got diet right, and yet the population is so lost and confused, we have miles to go before we sleep. So because there's so much to do and we know how to do it, and the value proposition is so richly established, this is a movement whose time has come. And I do think, just to append to that, we will be hearing more and more about the importance of getting diet right for both people and planet. For far too long, we've had discussions about diet as if we had every choice under the sun. And we just don't. 8 billion hungry Homo sapiens eating at scale. It just has a massive impact on the planet, and we're only ever going to have this one. And I think that recognition is burgeoning, that all of our actions have to take planetary health into account.
Thank you so much. I might add mine. So my prediction and hope, like you both worded it, is that we do a better job with pediatric mental health and pediatric nutrition, because all those kids are growing up into the adults that now you described have those challenges. So I hope as a society, not only the medical community, we all contribute to improve pediatric health, because it breaks my heart when I see emotional incidents rising there of problems, as well as nutrition problems. So thank you again for participating. I wanted to thank Jimmy Mistry and the Della team for offering us the opportunity to have this event, and we hope our audience enjoyed the valuable insights from both our speakers. Thank you again, Brian and Dave.